let's visit the Waterlab module. This module allows scenarios to be compared. However, the module is currently not working properly, which means that measures are not being implemented well. However, we can see what is possible within the Watershed information system. Here we'll have look scenario 1, painkiller diclofenac, annual average. So here we see the average yearly concentration of the painkiller diclofenac in the entire river basin when no measures are taken to further clean the effluent from sewage treatment plants. Diclofenac reaches high concentrations, more than 200 nanograms, in the German part of the river basin. But to estimate the possible contribution of a substance to ecological damage, water managers usually use the average concentration. However, when we look at the summer, when concentrations are higher due to low water levels, let's add another scenario. We move a little bit up. Then we see that in Germany diclofenac reaches much higher concentrations. Therefore, for a correct risk assessment of the ecological damage, the summer values should be used when all life in the water normally flourishes. And let's have a look to another medicine. For example, the blood pressure medication metoprolol. Here we see for metoprolol the annual average, especially in some Dutch cities, Enschede, Hengelo and Emmen, the metoprolol use is quite high, relatively high. But when we go to another scenario, the summer, the dry summer, here we see another picture, and especially in the rivers, metoprolol reaches higher concentrations, more than 200 nanograms per liter. So here again we see that the summer values are important for a more realistic risk assessment. Additional scenarios can be used to show the impact of measures. Let's add another scenario. Here we have 3 metoprolol, dry summer, and then we add an oxidation methodology, and then you could get a picture like this, that all medicines, or especially metoprolol, are oxidated, and so they disappear. And then there should be possibility to show the reduction for this scenario, but we don't see, it doesn't work very well. We see a very low level of reduction, but it should be much than 10% at least. And we can add another scenario for another diclofenac again, dry summer, and then we use filtration, nanofiltration, and here again you should see the difference if the measure is applied at all, in this case 52 sewage treatment plants of the watershed. And again the reduction percentage is not shown very well. It should be higher than 10% because a nanofiltration takes most of the medicines out of the water. Okay, so again you can use this scenario for just one or some sewage treatment plants and then see what's the impact on the whole watershed, or you can try it for all sewage treatment plants and then compare.